we are at risk. And you don't want to live your life in fear. You don't, because otherwise you might as well just stay in the house. But it helps to be aware. You know, it helps to be aware, it helps to be conscious of your decisions, and do those things. At my program in public health, we focus on the age group 10 to 19. And so a good part of what I will talk about at first is why we focus on youth. And if I can get this and talk. All right, so there was a study. Do folks know about adverse childhood experiences? We call them ACEs. Can you tell me?
Sure. So we use it as when we talk about trauma-informed care. It's this idea of having a what's the word? I had no concept. But having a record of your history, right, in terms of what have you experienced, specifically what have trauma you've experienced in your life, and how that impacts your life.
Right. Right. And it doesn't have to be violence. It could be the fact that, you know, you have a parent who has mental health issues, or you have a parent who has addiction issues. Any of those things that kind of disrupt that cycle and make a child vulnerable. Here it says, childhood experiences, both positive and negative, have a tremendous impact on future violence victimization and perpetration, as well as the development of risk factors for disease and well-being throughout the lifespan. Folks who have experienced trauma as kids are likely, as adults, to be one of our highest consumers of health care. And, you know, there are lots of autoimmune. Oh, there's a clicker.
We're fancy, huh?
You are. I'm not used to that. We'll have more visits to the hospital or to the doctor because they're dealing with more issues. And there's lots of research going on about how trauma impacts our health and impacts our body memory. So there's a lot of stuff that's always going on. But the reason further of why we focus on youth has to do with perpetration. 23% of reported cases of child sexual abuse are perpetrated by individuals under the age of 18. Okay? Youth who commit sex offenses against other children are more likely than adult sex offenders to offend in groups and at schools, and to have more male victims and younger victims. The number of youth coming to the attention of police for sex offenses increases sharply at age 12 and plateaus after age 14. So there's that pivotal area in there when kids are perpetrating. Now, teenagers perpetrating against kids, that's what we see in that particular age group. And the fact of the matter is, the child may have experienced some trauma of his own or her own. They may have, but they may not have. It might be something, they've been sexualized, and when I say they've been sexualized, they've seen mom and her boyfriend watching porn, or they've been looking at porn. And let me just say one thing about porn: it is on the computer,
Yes.
everywhere. In spite of what folks will tell you, it didn't just pop up. It doesn't just pop up. You gotta go to where those sites are and know that kids are spending anywhere from 4, 5 to 12 hours a day, if they have it, looking at porn.
So how do you denote the signs in your child? Just like the 15-year-old boy that was crawling in the ceiling at the high school against looking at girls. How do you know? What kind of signs can you?
I'm not sure that there are signs. That's the thing. That's why when we talk about sexual assault and sexual violence, it's not like there's a tell. You know, they might seem just as normal as the next guy. The fact of the matter is, if somebody wants to do those things, they're going to try and they're going to do it. If your son or daughter, mostly boys though, is watching a lot of porn, you're going to know because of the time they're spending on the computer. You know, you want to supervise where they've been, where they're going, what, you know, all those different things. And yeah, I know supervising your kid on the computer is a handful, but if you're not, then you got other things that you're gonna have to deal with.
Well, that's what I was thinking too, that they have tracking mechanisms on the computers and laptops, and whether it be the search engine or the history. So there is a way to do it. It's just that, and I know that they can erase it. I know
you
that.
You can't erase it completely, but let me just say, kids are slick. And they have lots of programs that can fake you out about what they're looking at.
Right. But so in finishing, if you are that concerned about your child and what your child is doing on the computer, it's incumbent of you to monitor the computer. My daughter has a computer, a printer, and everything, and I can monitor what she's doing, and she's not on that computer 4 or 5 hours a day. She needs to be doing something else other than being on the computer.
Right.
So there is a way to do it. It's just that we're making the time to get to do it.
Well, it's work.
It's work. Just like
It's like when you
anything.
put them on, punish them, and they're on restriction stuff. That you take away the car or whatever, you got to drive them places, and it's work for you. So it's a decision that you have to make, whether you're going to deal with that discomfort temporarily for the long run. 1 in 4 girls. Have you guys heard this? 1 in 4 girls and 1 in 7 boys are victimized by the age of 18. So if I were to count 1, 2, 3, 4, and Diane stood up, and then 1, 2, 3, 4, and then the young lady in the tan jacket stood up, and you see, the room would be full of people who potentially have been victimized. So it's prevalent. And this is based on numbers of people who have reported. Most people don't report. More than a third of women who report being raped before age 18 also experience rape as adults. You will be often be re-victimized, which is why we focus on college age too, because you've got college age girls going to school who were victimized. They may or may not have told anybody what happened to them, and here they are in this new environment, parties, alcohol, all those things happen at once. It's a rush in a lot of ways, and it's a lot of stuff coming at you at one time. And it is not unusual for someone who was victimized young to be re-victimized throughout their lives. Abusive relationships, the whole 9. So, I put these 2 stats in green and teal because they are specifically pertaining to Georgia, and the stats are dated, but it gives you an idea of what a problem it is here for us, and that is that at one point we were ranked first in teen dating violence. I'm talking about high school and middle school. First in the country. Now we're 3. Still nothing to brag about. There's a problem. We don't know why, what, but we're out there fighting the mighty fight. Those kind of statistics are difficult to swallow, but there are signs with that. What do you think some of the signs are for someone in an abusive relationship, emotional or physical?
Emotionally, I would say to be withdrawn.
Withdrawn? Okay, what else?
Taking sick leave at work.
Sick leave at work, yep. What else?
Long sleeves?
Long sleeves, hiding bruises and stuff, what else? Think about it, you've got a girlfriend and you guys are out with your respective boyfriends, and the way he talks to her kind of raises a
There's a matter of control too, right?
issue of control. Separating you from friends
Friends and family.
and family. They want you all to themselves. And that kind of behavior can be, if you're in high school and it's a very social time, and the woman or the girl or the boy is jealous of other people's attention, that's a red flag. Because of course you have other people in your life. Think about this one. 100 teens and young adults lost their lives in 2010 to intimate partner violence. And 1 in 3 Georgia teens have experienced dating violence. We're talking about murder, suicide, and also in Georgia, the lethality for adult women who are in abusive relationships is off the charts. Women of color, black women particularly, are more likely in an abusive relationship to be murdered. You're not going to see that on Channel 2. It's a hard fact to swallow, because what do you do with that? What do you do with that? And how do you keep your sanity? I've been doing this work for 30 years, and I drink a lot. I'm just kidding. But you have to find ways for self-care, because the statistics and the information and the stories over and over and over, they take their toll. There's a lot that you see and hear, and in that time, that 30 years, the sad part is there's not a whole lot of information that's changed. Nationally, they will tell you that sexual violence has gone down, particularly rape, because when people talk about sexual violence, they typically are talking about rape. In public health, we talk about the full range of behaviors, from peeping toms, which we find sometimes amusing because we think of it as non-threatening until it happens to us, right? Peeping tom to rape by a stranger. It's all the behavior in between. Sexual harassment in school, at work, date rape, which some people have unfortunately started calling rape light. No. You are being assaulted by somebody that you know. That messes with all of your trust stuff. You know, you can explain away in your head why a stranger would be out there lurking, because we're taught about strangers, right? We aren't taught about those close to us who could do harm.
Since there's police officers in here, I know of a parent that her daughter and the young man were dating. The young lady was 16, he was 18. For a long period of time, she knew that they were dating, but she did not like the young man. With that being said, she brought charges of rape against the young man. Even though, I don't know what law it is, the young ladies refused, told the judge, no, this was consensual. I did it on my own.
Well, perhaps, no mean to interrupt, that she was below the age of 16.
No, she was 16.
Or maybe the encounter happened prior to her reaching the age of 16.
Because 16 is the age of consent.
Well, she was 16, from what we understand. So you're saying that the parent was able to bring these rape charges against this young man, which ruined his whole life, because now he can't. He's did 2 years. He's got 7 years on parole, but he can't be near school. He can't be near daycare. He can't be near so many places, and his parents is trying to place him to get him work, and that, you know. So where do you draw the line between consensual and
He's a sex offender.
and a sex offender? Yeah.
Well, the line is really not thin. The way it's explained to people, it's like, oh, you're going to step over and suddenly you're in Badlands. It's not that simple. You're going to say something before?
Yeah, so sometimes the legal system can be, it's not perfect. The justice system is not perfect whatsoever. So what you may have had was the daughter went to the parents and said, hey, when the parents found out about the relationship, and maybe said, hey, this was rape. So they go through the process of, and this is pure speculation. They went to the process of reporting it to the police, going to the criminal justice system, and later she may have gone to the judge and said, hey, this was not rape, this was consensual. But then the judge is going to be like, well, why are you changing your mind now?
Well, actually,
And
just
I
I will give you a little bit more about just the opposite, because now the mother and the daughter have no relationship, because she's told her mother, please don't do this. If you do this, then I will never speak to you again. But for some reason, because the mother did not like this boy, And even the boy's parents went to her and said, please don't do this to my child.
And see,
But
I
there's
can't
a
explain
law
away,
that
though.
the mother was able to,
But see, that in itself says to me that there is some other piece.
Okay.
Because these things don't very often go to trial,
Right.
let alone get a conviction.
okay.
You know, we just don't.
It's
It
about
does-
less than 1% of sexual
Yeah,
offenses get
they
sexual.
don't, they
Okay.
don't end up going, so for him to have, actually been charged and then serve time, there's something in there that's missing.
Some other circumstances have to be in there.
Okay.
Mhm. So, you know, and in talking about that, we get a lot, I do a lot of work around consent. And it's not, you know, people say, well, you need to fill out some papers. First of all, we need to start talking to each other. It's, to me, is one of those things where we're gonna be intimate with our bodies, but we're not gonna talk about what we're gonna do or what not gonna do, what we're not gonna do. So I'll flash my breasts, but I don't wanna talk about it. And there's something wrong with that.
Yes.
And that's what our culture encourages us to do, but not think about and not talk about it.
Wasn't there an incident recently with a football player, I think was at Mardi Gras, and that's a situation, a young lady seemed to have been inebriated, flashed her breasts, and so it's almost like she opened the invitation, and then the guys got into it and touched her, and then now, I don't know, because I haven't been following the news, I think charges, or there's something that may come up against the football player.
Well, let me just tell you, you cannot consent if you are in any way inebriated. If it's cold medicine, if it's liquor, if it's pot, whatever it is. If mushrooms, if you aren't able, if you're under the influence, you cannot consent, period. So for me, part of what I'm doing, my job is in educating kids about this stuff, because people will bring up that rare exception, and yeah, there are gonna be exceptions, but as a general rule, if you're aware, if you're talking, if you have respect for other people, you can, and I'm talking about in intimate relationships, you can avoid some of this stuff. You can avoid it. That is not to say that if it happens to you, that is your fault, because it's not. If I decide that I wanna go out and have a drink, hear some jazz, then I should be able to go out and have a drink and have some jazz. What's she doing out? She's too old. I can go out.
Right, judgment.
You know, so there are all these different pieces that go into why it happened to you, and really all that does is try to make us feel safe, because we don't want to think that when we're going out, something can happen. No. So going back on. Georgia's ranked 10th in the United States for domestic violence lethality, and like I said, with black women, it's even more than that. 50% of victims began their relationship with their killer in high school.
Wow.
So I've talked to you about sexual violence. I know you. Hi. I'm good. What is sexual violence? A term that includes rape, incest, child sexual abuse, sexual exploitation, unwanted sexual contact, sexual harassment, exposure, and voyeurism. And we're hearing a lot now about human trafficking,
Yes.
right? And I just want to, American Crimes, what is it? American Crime Story, a TV show, just started last Sunday, and this time they're focusing on human trafficking. So there might be some information in that, because they typically do a really good job. It's not a documentary, but they do a good job of addressing the particular issue. It's a complex issue. We can't just go on the streets and say, okay, come on, we're gonna take care of you. These are young women and often young men who have been taken care of by their pimps since they were 13, 14, 15. These are people who left home for whatever reason and are vulnerable, and they find somebody who's offering them that support and love that they thought they were looking for, and they think this person is going to give it to them. So they're into a life that they aren't necessarily wanting, but they're stuck. But that's more and more. So we will talk, you will hear a lot of things, and there's a kind of a slant again where they're talking about kids being abducted. Kids are abducted. Oftentimes, though, kids are pimped out by their parents when they're young. So it's not all clean and neat and tidy. Sometimes you just deal with the fact that there are just all these different, there's some bad folks in the world. There's some damaged folks in the world. And they might be working in right next to you in the next cube, you know, and so you don't know. Sexual violence prevention, we go, public health is rooted in research, and so we don't deal with the defense stuff like Mr. Webb does. You don't touch that with a 10-foot pole. It has its role, but what we're doing is research and also focusing on prevention of it taking place in the first place. So we have 4 programs that I work with, and all of them are addressing sexual assault and eliminating that first-time perpetration and victimization. For it to be based on CDC, for it to be prevention, these are the 9 elements that need to be included. Comprehensive. You have to use varied teaching methods, but that's because people learn differently, right? Sufficient dosage, so I can do this today, but this is not prevention. This is awareness. I'm letting y'all know what the deal is. If you want me to do more, I can come back for X, Y, and Z number of times, right? And we can do a curriculum and do all kinds of things, exercises and that kind of thing. Has its place, it has value, but it's not prevention. Theory driven, they want to know why you're doing what you're doing. What's it based on? Positive relationships, appropriately timed. Appropriately timed means the right age and the right amount of service, the right amount of time, the right amount of information. So if I do something for hours, I mean, that's still not going to kick it, right? The age group, the curriculum needs to be appropriate for the age. A lot of folks have talked about and know about good touch, bad touch for their little kids. And, you know, after research, we found that that wasn't necessarily effective because it might be bad, but it might feel good.
Right.
And how do you explain that to your 4.5-year-old? Yeah. And so you look for different ways to get that information across. Culturally relevant. You know, what works in the burbs isn't necessarily going to work in the hood. What works in Atlanta isn't necessarily going to work in South Georgia. Lord have mercy. You know, trying to get stuff that, you know, everybody else in the state calls it the state of Atlanta, because once you get past Macon, what? There are resources, we're losing hospitals, it's all, you know, empty. You have to do outcome evaluation and your staff need to be trained. And so a lot of folks are hiring prevention folks, but you gotta be comfortable in front of a crowd. And I'm an introvert, so this will exhaust me. At the end of the day, I probably will stay by myself.
You're doing really good.
Because I'll be worn out. But I can do this to get the information out, because this is about the work I do.
Yeah.
I can do that. But don't ask me nothing else. Target group, we've got 4 groups. The target group is 10 to 19. Safe Dates is one of our programs. It's teen dating violence, and we are implementing those in schools through our Rape Crisis Center partnerships. Step Up, Step In is an awareness campaign that we develop for sexual bullying. Middle school is a particularly tough time for kids, and sexual name calling, sexting, talking about sexual exploits, and kids may not even know what they're talking about, but it doesn't stop them from saying it, and it doesn't stop them from hurting other people when they do it. So it's been really helpful. We've done that, implemented that through a partnership with our health districts, who then partner with middle and high schools. Coaching Boys into Men is our one of our efforts to engage men. These are coaches who take a curriculum that we have and teaches them about respecting young women and healthy relationships and bystander intervention, all through 20-minute lessons that they get weekly. And we worked with a school in Sandy Springs this past year and had the buy-in, which is very important, had the buy-in from the coach. All 9 of his coaches also trained and taught the kids, and it was very successful. It's hard though, because our coaches are often part of that continuum of the problem. You throw like a girl, doesn't sound like it's a problem, but if you are in a habit of disrespecting or in a habit of objectifying, you're not gonna cut that off when you're in a relationship with somebody. That kind of attitude is gonna prevail. I don't need to mention any high-profile cases for anybody to understand what I'm saying, right? We're good. We got it. I mean, it was on film. On film, and still, people doubted it. What did you say? What did you do? If you just, it's never, we don't provoke somebody into doing that. There are high volatile, high emotional situations, but it's never that simple. He said, she said, and then all of a sudden we fought. Those relationships are toxic, and it's going to be a lot more going on daily than what that one incident will tell you. Bless you. So with the partners, one in 4 and beyond, we work with colleges and universities. We're working with 3 small colleges. I specifically chose smaller ones, 15,000 students and under, because they have less resources. And so far we've worked with Fort Valley, which is an HBCU in Fort Valley. We did a semester at Savannah State, and we've done Middle Georgia College. Thank you. And no, I get it mixed up. It's Georgia College and State University. And West Georgia. And so we train peer educators, and then we turn them loose to train, educate groups of guys on campus from athletics, fraternities, student government dorms, about sexual violence and how to be supportive of somebody who comes to you and tells you that they've been violated, talking to people about what sexual violence is, bystander intervention, holding each other accountable. Yes, ma'am.
Why do you think most university campuses don't have programs like this, where you're peer teaching and peer coaching and having peer support programs?
They do. And are you still at UGA?
I'm not.
Okay. Okay, you're at Emory now? Well, you can still speak to it. It wasn't a priority. It's become a priority due to people like Vice President Biden, who made it a target.
Go Vice President Biden, yes.
Yeah. To address it on campus, because the numbers are so startling. And people don't understand it. So they don't know how to do the resources. They've never really quite learned about prevention, because they're not in a position to learn about prevention. So you're adding an element to student affairs that hasn't been a part of it. You have sexual, reproductive stuff, and you can talk about HIV and all those kind of things, but the sexual violence piece is, while not new on campus, a new service area. But I mean, Emory's more advanced than most.
I think it really varies campus to campus with like resources that are available, as well as funding that is allocated towards it. So I think it really varies for each campus and where that is based out of. Let's say a women's center versus a student's office, and it can really depend. So while there tends to be some commonalities in how they approach the work, including supporting survivors and direct service and advocacy services
is money is an issue, and policy is a big issue. As a matter of fact, I'm finding, working with the college campuses, that I can teach all day about the peer educators, but you got to have policies that support victims, that support the whole investigative system, and you got to stick to it. But I'm not going to talk about policy because then I'll get sidetracked.
Well, and if it's a public or a private school, that can govern different. And,
Right.
Yeah, just the overall system of response, and not just prevention services.
Sure.
But also like actual response and stakeholders who are engaged, or if they rely more heavily on community partners. So, yeah, depends on the school.
It's complicated.
Okay.
And there are lots of moving parts. I mean, you can tell there are
Yeah.
just lots of moving parts, and a lot of schools have historically not wanted to deal with it because then they have to admit that there's a problem.
And but you had that big case where what it was, the men's what is it, rowing team and the party and the strippers, and you know, these boys being, you know, the school got bad press, of course, but you have lives that are just ruined, you know, on both ends. And so, you know, how long will they continue to ignore that it isn't a problem? You know, yes, as young people, we make bad decisions. We go to parties, we get drunk, alcohol gets involved, and all these things. But it happens off campus and on campus as well, you know?
Well, it's a reflection of the community, the
Right.
larger community.
That's right,
what
yeah.
happens,
Yeah.
you know, on Friday night when you go out with your friends, and that's part of it. So, you know, it's one continuum, and the university campus is a microcosm of what's happening in the larger community.
Right.
We don't want to talk about it until we're comfortable talking about it and calling it what it is. We're going to continue to have these kind of problems. I'm probably the most proud of being able to involve men in a positive way. You know, the research says like 10% of the male community, 10% of perpetrators are males or perpetrators. Everybody else either sees what's going on or knows what's going on, but they don't feel empowered to say anything, or they don't feel empowered to do something. And so I like the fact that we're bringing this into the discussion, because these guys aren't saints when they come to us. They're not, you know, they aren't people who are saying, yeah, I got this down and I treat women. They have a lot of the same biases that everybody else has. And it's great to hear them have these conversations in a safe setting, and then see their aha moments when they get it.
Are you just in a certain area, or are you all throughout Georgia?
All throughout Georgia, but that's relative, because you know, we're so big. But one of the reasons I expanded from just one program to 3 is so that we could reach different pockets of the population. So while I'm in a couple places in South Georgia, and I think one place up north, it's still largely Macon, Metro Atlanta. But the goal is, because I do advertise for RFPs for people to respond from throughout the state, because that's what we're charged with, big as it is. And like I said, the rape crisis centers are doing safe dates that are partnering with us, and the health districts. We have 18 health districts, so again, given the number of counties that we have in the state, that's not a lot. And we have 30 rape crisis centers, not counting colleges. And we have 150 something counties. No way we can take care of everything, right? That's a problem. But funding is what keeps us from being able to actually spread services throughout different parts of the state. And that's me in a nutshell. That's what I do.
Awesome.
Now that I know you're here. Any other questions?
How did, if you know middle schools, or I know there's some private schools, how do they get these programs delivered to them? What if you wanted to see it done at, say, a middle school here in Cobb County? What do they have to do in order to have that done? Because I've just heard, I have a child that's in middle school this year, and I heard her come back home the other day, and she brought up boy who's doing name calling, and she's trying to kind of decipher what it all means. You know, they giggling and laughing, so the terms that they're hearing the young men say, or female, she don't understand it, but she's laughing, giggling to what they're calling other
Sure.
people, just because they're calling them a name.
Well, one, they have to want to have somebody come in.
Okay.
The schools where we're most successful are those schools who, the Rape Crisis Centers built a relationship with the school. So first of all, there's the relationship building, like with anything else. And then they are going into, actually, they're more successful in 9th grade, which is just after, of course, 9th grade. They all have to take health, and they go into the health classes. And so they will use this curriculum to, over a period of 2 weeks, to get that information out there. But it starts with the relationship building. And for Cobb, that would be, they're not one of our funded partners, but I would start with the Y up in Cobb County. Anybody?
I have a question. So you said, I don't know if it was teens or just women, but 1 in 4 had actually been a victim,
Mhm.
and that was just the people that report it. Of the people that actually report it, how many seek help afterwards? And so not just going to the cops and reporting it, but how many actually seek treatment or, you know?
Most don't tell.
Okay.
Okay, so if they tell law enforcement, what I found working at the community level is that they'll report, if they report it, and we go through the exam, follow-up is nil.
That's what I was worried about. Okay.
I don't wanna talk about it, and it's hard to get.
That's what I was worried about. Okay.
But we do get people who were victimized a few years ago coming back for services.
Okay.
Because a life event, whether it's having a baby, whether it's getting married, you
It's
know,
triggered
whether it's something's been triggered, and they will come in for services. But it's typically, in my experience, not, they let them go. Unless they're, you know, gonna be going through courts and they're involved with you.
Yeah.
And they, no. It's complicated, and even though it can be frustrating at times, it's also rewarding, and you see little needle moves. You don't see big, grand things happening, but you do see people learning from the work we're doing, and so that's how I can manage to do it for another 10 years.
All right.
Thank you for having me.
Thank you.
Thank you so much. That was awesome. I hope that was informative.
Yes.
Yeah, that was really good.
Oh, okay.
Take this down. And so we're gonna switch up just a little bit. Senator Donzala James is very sick.
Yes.
So what we're gonna do, is do a call-in and have her office speak real quick. I hope that is okay with you guys? Okay, let me see if I remember my training here.
You have reached the voicemail box of 4.
We could, if we don't get the privilege, just keep it rolling.
Yes.
And then we'll get one up. We'll keep trying, don't worry.
Probably waiting on the 11th.
Okay. We'll just keep it moving. Okay. my presenters, please do not leave. I have to make sure you get your gifts and all that good stuff, okay? Please, don't run out of here.
Okay, we're about to call you now. We're about to call you right now. All right. So, we did tell her like 11:30, and then we're just trying to motivate and switch things around. So this is going to be the community awareness legislation and safety part with Senator Donzella James, assistant for South.
Hi, good afternoon. I'm so glad that you're able to join us at the SVP Forum today. How are you?
I'm doing well.
Doing well. And our hearts and minds are with the senator right now. We understand that she's not well and she couldn't be here. So we appreciate this opportunity to connect with her via phone. Well, connect with your office via phone. So please go ahead and share with us your thoughts about the subject matter of sexual violence prevention and how it pertains to Georgia legislation and whatever that you guys are doing to keep us safe.
Okay, and thank you so much for having her. You know, I am speaking on behalf of Senator James, who represents District 35, which that includes Fulton and Douglas County. And she wanted you to know that throughout her career as a legislator, one of the primary focuses has always been on reducing the prevalence of sexual violence, increasing the penalties against those that commit an act of sexual violence. So one of the first things is the Child Sexual Commerce Prevention Act of 2001. It was greatly expanded penalties for those convicted of trafficking a minor. Increases fines and penalties for those convicted of child sex trafficking. Also, Senate Bill 104, which is human trafficking hotline model notice in the government and federal buildings. She sponsored the Senate Bill 104, which required government entities to post the human trafficking hotline model notice inside designated government buildings. It will also require government entities to provide a link on their website to the notice on the Georgia Bureau of Investigation website. And this bill is, it passed in the Senate by a vote of 6-0. Additionally, Senate Bill 145, which changed the definition of race, 2017. It also recently introduced designed to remove a gender requirement for the offense of race. This Bill 145 would repeal gender language in current law and replace it with persons who more fully encompass the issues of race. He wants you to know that far too long, our legal definition of race has been an act only between a man and a woman, while federal law, which supersedes Georgia law, still criminalizes an act of rape regardless of gender. Georgia simply needs to modernize codes to match federal guidelines and to be inclusive of all citizens. After talking to students on the college campus throughout the metro Atlanta, she's seen a need to remove the gender requirement altogether to more exclusively cover any victim of an unwanted sexual act.
This bill would extend legal protection for any gender and is hopefully a step toward eliminating rape for good.
Wow.
Senate Bill 145 would also include the definition of aggravated sodomy and aggravated sexual battery in 55 definitions of rape. Senate Bill 145 was also referred to the Senate Judiciary Committee, where it received favorable consideration, but unfortunately did not make it to the rules calendar by the crossover date, so it will have to be for next year. Safe Harbor Racial Law, 2016, originally passed to the Senate as the Senate Resolution 7. Constitutional agreement for safe harbor for sexual exploited spiritual funds. It is estimated that a safe harbor fund will provide as much as $2 billion annually in funding dedicated to providing restoration services and support to the child victims of sex trafficking who are able to escape horrific circumstances. Funds will be distributed by an appointed commission directly to the agency, faith-based organizations, and nonprofits who provide the safe housing, trauma counsel, medical treatment, and other resources that still desperately need. The funds will come from two sources: additional penalties on convicted sex trafficking and a new view of the adult entertainment. The creation of the Safe Harbor Fund would not raise or create new taxes for Georgia, and that's a good thing she wanted you to know. By adding the Safe Harbor Fund, state constitution, funds will be permanently protected and used solely for the purposes of providing restoration services to child victims. This ballot was approved by 85% of Georgia General Assembly last year and passed. Domestic body, one of the co-author with Senator Connie Stokes and Senate Bill 16 several years ago. Senate Bill 16 took a firm stand against destructive acts of family violence in the home and creates a new crime of family violence battery. Address being committed against past or present spouse, children, stepchildren, foster children, and other persons living in the same household. Participants can be put in jail for up to 1 year, and second and subsequent incidents of felonies carry a prison term of 5 years. And in conclusion, it's proud of all the fighters that he's made in recent years in reducing the prevalence of sexual violence. There is still so much work to be done. Unfortunately, sex crimes are still far too common. But rest assured that she is doing everything in her power in the Georgia legislature to see that those who commit these acts of sexual violence face the penalty they deserve and receive the care and attention that they require.
Well, thank you so much for that overview of all of the hard work that Senator Gonzalez James is currently doing in the state of Georgia. Please let her know that we appreciate her and we look forward to having her in the future as we plan more of these public events where we are able to share exactly what our grassroots fighters are doing to keep us safe. So please give her our regards, and I thank you so much for your time.
Okay, and one more thing, thank you so very much. In addition to that, she wants you all to be on the lookout for Senate Bill 104. Make sure you vote, and you know she's very, this is something that she's very serious about, and just wants you all to make sure that you be on the lookout and vote for the House
Well, let me repeat it, especially for the social media viewers who are not probably able to pick up on the sound since we're doing the conference connection. It is Senate Bill 104, and
Yes.
Does she have a title for that bill?
Yes, it's human trafficking hotline model notices in government buildings.
Okay, so slowly, human trafficking hotline,
Model notices. of
model
government
notices
buildings in government buildings.
in government building. And so you guys look out for that. Vote, vote, vote. Support the senator. Support her committee. And you know, together we can do this. Thank you so much. Have a wonderful day. Okay.
Thank you so much, and you guys have a good day. And thank you for inviting her.
It's my pleasure. Bye bye. Okay. Thank you. All right. So we're gonna go ahead and keep it moving. And so I'm really excited to introduce Miss Wanda Swan. She is the director of the Emory Respect Program, and just as I think she's in the hall, so somebody needs to go grab her. Oh, she's right there. Oh, come on. Sorry. And so as Ms. Mosi Bayo spoke about earlier, about more programs needing to be on college campuses, and that she did clue to the fact that Emory was a little bit ahead, and I'm so proud of that fact. So Ms. Swan will definitely educate you guys, enlighten you guys on what it is that Emory is doing to address this issue. And hopefully this will, you know, sort of propel or initiate a conversation for other university systems to watch this model. It's a model, right? All right, thank you.
Thank you so much. Good morning. Well, is it still morning? Almost noon. Almost noon. How y'all doing? I'm Wanda Swan, and I serve as the director of the Respect Program here on Emory University's campus. We're located under the umbrella of the Office of Health Promotion. And so I have a few slides today. We're going to talk a little bit about the bare bones, like just the structure of what Respect looks like, and how it navigates the space on campus with the larger Emory, and how we're able to get some things done that we're very proud of and continue to fight on some things that we still need to do. I am going to start it now. I will try to stick to the slides, but I enjoy any opportunity for us to have a dialogue back and forth. I hate lecture-based lecture style. I hated it when I was at school. Sometimes when I sit in church, I like to talk back. And so please feel free to do that, because this is all about a conversation, right? This is all about a conversation, and you're all here today for one reason or another, because this is something that's salient to you for whatever reason. And at the end of the day, we're all looking at how we can better protect those in our community, those who are going entering our school systems. And so hopefully we can have some really good dialogue about it. So what you see here is a really interesting rainbow diagram that kind of looks at where we're situated in campus life. And this is Emory campus life, right? And so you can't, it's supposed to be a rainbow, sunburst, something. Somebody got real creative and got a little overzealous with the design. But we are actually right here in the whole grand scheme of things. So when we look at campus life at Emory, we're under the community portfolio, and our office, the Office of Health Promotion is here, and we are right there. So, I'll give you a closer look at what that actually looks like within the office. So, we're housed under the Office of Health Promotion, which is honestly, it is an umbrella of several programs. So we handle alcohol, tobacco, and other drugs. We have a substance abuse counselor, and we also have a prevention strategist whose job is to figure out how do we get a firmer handle on the presence of alcohol and drugs on our college campuses, and how we're supporting and educating our students about the dangers of it. We also do sex education, sleep well, and we do community well-being. How are we taking care of our students? What are some things that the students need to know that they won't find in the academic classroom, right? And then there's us, the Respect program. And so we have, our structure has changed. I've been in the office for 2 years, and I was recently promoted to director, and I had the opportunity to hire some really awesome folk. My assistant director of prevention is Michelle Passano. She's here today. And my Respect Resource Specialist is Jamisha Duncan, who is also here today. I often refer to us, I say I am Michael Jordan with 2 Scottie Pippens, and they are my Scottie Pippens. And to picture it being mid-90s championship ring, that's how they make me feel every day. And that's why I keep coming to work. That's why. That's why. Because this is hard. And so, y'all, they have been here, it hasn't even been 5 months. And every night this week, we have had early morning and a very late night. And when I mean late night, we're there so early it's dark, we leave it's dark, and we can't tell the difference. And they're here today. And for some reason this week, this is going to be a 7-day work week, and they're still here, and they have not quit. Yay! So I appreciate them. And so the rest of the structure, when I first came here, I was actually the Associate Director of Advocacy, and that was my role. I was the advocate for the students at Emory University. So anyone who has experienced any form of violence, been impacted in any way, I work directly with that student to try to provide resources. And I do accompaniment, whether it's hospital accompaniment, court accompaniment, or any other form. So that was the role. And so when I was promoted, that position is vacant. And so we're asking now for funding for a position. What is so beautiful about the structure that we have now is that everyone within the Respect program has experience doing prevention strategy work and also direct advocacy services. So for a long time, Respect was this 2-tier, like this side of the hallway was prevention, this side was advocacy, and there has to be a marriage that needs to take place in order for it for you to really understand and inform each other's work. But with all that being said, we're tired and we need an advocate position. So I put this in every presentation that I go to in the hopes that somebody is sitting somewhere who knows somebody that says, you know who did an advocate? The Respect program. So if y'all know somebody who knows somebody, tell them that I've been talking about them and that I'm still looking for my advocate. We also have a graduate assistant within our Respect program who handles a lot of our bystander intervention campaigns. Emory, the Respect program within itself has been blessed in that we have a really great relationship with our public health program, and these are eager students who are looking at prevention strategies and ways of how to actively reduce violence. And so a lot of our students come from those programs, and they're like, we want to create a bystander intervention program specifically for Emory. Okay, what you need? Let me help you out. What you want? You want something to drink? Let me help you. What can I do for you? Because that's so helpful to us. We are a 3-person team, and so having that student cohesiveness and interest is very important. And that is a lot of the work that our graduate assistants, they're usually from Rollins, they come in with great ideas, and they want to change the world. And we want to change the world, so this kind of works out. So at the root of who we are a program that engages the community in interpersonal violence prevention and survivor resiliency. Before I was director of the Respect program, our mission was we engaged the Emory community in sexual violence prevention and survivor advocacy. That always bothered me. But you know, when you're not the boss, you can't really say much, especially when you first get there, you first get started. But that was one of the things I've always, it kind of bothered me. I felt like this idea of survivor advocacy and survivor resiliency are 2 different things. And I think in higher ed, we're so compliance and crisis focused, we're so in the moment focused, that after that moment of crisis passes, no one is checking for these survivors after that. And there's a life after this that we need to talk we need to talk about resiliency. And so that was one of the things that I wanted I wanted us to change our scope. We end violence by ending oppression. That is another difference in where Respect program has gone. We have been known and rewarded and nationally recognized for our work with sexual assault prevention and advocacy, and we're very proud of it. But that's not enough. It's just not enough. Especially as someone who started this as an advocate in this field, I realized that a lot of the students I was seeing didn't look like me. Period. That's a problem for me, because we all know the stats around sexual assault. We all know the stats around sexual violence, and we know that women of color, black women, trans women of color are impacted in higher numbers. And if I ain't seeing nobody who looks like me in that space, that means this space is not safe for them.
Say it, you got it.
Yes, ma'am. That's my amen corner in the back. Yes, ma'am. And so, what I realized is that when I became director, I inherited a very white space, a space that served a particular type of Emory student, and that just wasn't good enough. And when I finally had the opportunity to talk with a student of color and ask, why not respect? The answer was basically because that's not for me. That's for the white girls on Brick Row. And I got more important things, more pressing things going on in my life than sexual assault. This is nothing compared to what I'm going through. And so I can put this to the side. So the fact that someone can say, this is not for me, and you're paying money to be here. Like you have the privilege, the right to be a part of this, and you don't feel that way. And then the fact that you're saying that this is not the worst. We were doing something wrong. We got to figure this out. So we made a couple changes. We did continue with the vision, because we want all students to learn, work, play, and love within the Emory community. We also want them to be educated, and we want them to have a leg in this movement, and we want them to be able to take that into their other communities and to do that as well. And we value social justice, advocacy, collaboration, excellence, and student empowerment. So at the heart of what we do, this gives you a little bit of information of how we kind of separate our work between advocacy and prevention education. We are considered the university's central hub for the work of prevention, education, as well as direct survivor support. We end violence by ending oppression. I say it all the time. In some spaces I get hallelujah. In some spaces people get real nervous. It don't matter. I'm going to keep on saying it anyway. But on the advocacy side, we are considered confidential with an asterisk. And so in a lot of spaces, we on college campuses, the work of advocates are done by those who don't have a licensure, right? So we're not counselors, we're not therapists, but we are trained in trauma-informed care and advocacy-based counseling. I'll tell you a little bit about that later. But in a lot of spaces, it's very hard in the state of Georgia for a lot of universities who actually have advocates on their campus, because not everyone does, okay? But even for the ones who actually have it, it is very hard for us to have confidentiality status or confidential status. And Emory affords us the opportunity to have that, but that asterisk means that we are required by federal government, by Cleary, to provide what we call de-identifying information. So the Cleary Act is an act that came to be in the 90s, and it was based on the life and death of Jean Cleary, a student and I can't remember at this point what college, but it was, at one point in time, universities thought that it was appropriate to not report out their numbers of incidents on college campuses. And someone who has been working in this field for a little like 10 years now, still a baby, only 10 years, I'm barely crawling, honestly, in this field. I worked, one of my first institutions where I worked wanted to maintain this Mayberry status. I'm from Mississippi. My first job was in Mississippi, and they wanted to maintain this gonna put all of our incident numbers at 0. And so, when that happened, what we're doing, we're not accurately depicting the culture of our campus, and we are lying to our students, we're lying to their families, and we are not giving them the full scope of being able to make a decision as to where they should go and how they would feel safe. And so the federal government, the Clery Act law, mandates all universities to do that. And so that is that piece that we have to deliver. And it's de-identifying, which means we won't disclose the student's name, but we will say this was a student, whether this student was undergraduate or graduate, whether this happened on campus or off campus, what type of assault this was, right? So we're confidential with an asterisk. We provide advocacy-based counseling and support, which means we listen, we explain all options, we do some case management, we do a little bit of everything. We're not therapists, but we provide a therapeutic setting for students to have these conversations and to disclose. We provide accompaniment and accommodations. We have recently become an on-call rotation space, so that means we are on call 24/7 at this point, and it will go into effect with a hotline, official hotline campaign and number on April 3rd. And the three of us and that advocate, when they get here, y'all remember, tell somebody if you know somebody that we're looking for one. We will rotate that responsibility. On the prevention education side, we take it very seriously, the charge of creating population level change on our campus and to activate our student groups and our student environments, our different communities, to take a stand and figure out what part of this movement they're gonna take up, because you gotta take it up, because you either against it or you are supporting it. And there is no neutral, and I'm just gonna sit this out this one time. That's not how life works. You're either against it and you're actively fighting against all forms of violence and oppression, or you're supporting it through your silence. And that is how we present these options to our students. We work often to engage stakeholders. As you can possibly imagine, it's really hard to market sexual violence prevention or anti-oppression work during orientation and whatnot. You know, that can be a little tricky. But I am very confident. I am a storyteller. I come from a long line of storytellers, and the one thing that I know about this job, what I realize is that I have been blessed with gifts and talents to make people like me for no complete reason at all. A lot of y'all are gonna leave here today and you're gonna like me, you don't even know why. But that is just the skill set that I bring. Look, Anthony is a product, right? When I first came here, Anthony was one of the first people that I met. He did Korean barbecue. Why? He don't know. I just have that face. I just have that personality. He don't know. Meh, that's fine. Yeah, so I use that. I use all of my talent. I use all of my skills, because I am not leaving here until we have, honestly, a standalone center dedicated to anti-oppression work, violence prevention, education, and support. That's my main goal. That's my goal. So if y'all see that I left, it's because they put me out. It's not because I wanted to go. We also do training on the root causes of violence. You know, I think that is the piece, right? Mosi, you were so awesome. Your presentation was great this morning, and as I was listening to it, and I was sitting back there, and I was like, oh, look at this flow. We just flow right into the work that we do. Like the students and the community that you're working with, they just flow right onto these college campuses, right? And so it's a continuation of the work that you're doing, right? That you are planting these seeds, and what we're doing, I think we're just trying to sustain what you started with these students, with these minds, and I appreciate that, because it's hard. I know I've been in this field long enough to know what I can do and what I can't do, and a lot of education of younger students, and those stories of younger students. Like I got a chest of stories too, right? I don't know if I can hold that chest if they were younger students, and so, or just younger people. So I appreciate that. And what happens is when they come to me, we're able to take care of them in a way that continues the work that you've done. We work to help students unlearn a lot of things that society teaches us. It's a lot of things that there's so many messages that come that we just accept because we don't know the difference. We don't know. And so a lot of our work is unlearning, helping these students unlearn what they've been taught. And we work to try to create a survivor supportive campus, and we try to help students understand, and not just students. We are training faculty and staff too, because you're talking about a whole level of folks who don't know, and when you get to a certain level, not only do you not know, you also don't want to be taught. Yes.
Can you give an example of something that students had to be untrained or relearned?
Yes.
Please.
Yes, ma'am. Consent. Consent within itself, y'all. If I had the key, if I had the answer, if I had the secret as to how, in like one shot, how to gain a better understanding, I would not be working here. I'll be opening up my own business. I'll still hire my folks who with me, and we will make a lot of money, because consent is something that people don't know.
Please explain what that means. Yes,
so when we talk about consent, we're talking about this idea of mutually agreeable acts, right? How I explain it to my students that are coming into Emory's campus, like these are freshmen coming in, orientation, bright-eyed, bushy tail, yay, I'm a college student now, I'm an adult, yay, yay. They come and they sit down, and I'm like, let's talk about consent. Consent, according to the definition that Emory University uses, I tell them all the time, Emory University wants you to know that if you're going to have sex, we want you to have great sex, okay? And what great sex means is sex with consent. We want you to get a hell yeah every time you want to have sex with somebody. We don't want you to get a no. If you are going to engage in acts and be mutually agreeable upon those acts, if you are an adult, if you are a college student, and if that's what you want to do, I need you to understand that in order for you to do that and to have a great experience, we want you to gain consent. That basically means you need to know it is a mutually agreeable, you both are agreeing that this is what you want. You also have to understand that consent can be withdrawn at any time. If I am engaged in a sex act with somebody and I say I no longer want this, that is non-negotiable. I don't want it. We done. And if we're not done, that's a problem. So we have to teach our students, we have to teach our kids what it means to consent. Consenting to one thing doesn't mean I'm consenting to everything. You gotta ask me. The onus is on the person who wants to continue the sex act to check in and say, is this still okay? You still want to do this? And see, a lot of pushback that I get from students is, don't nobody want us out doing, don't nobody, it ruins the mood. And I just tell them up front, y'all, I said, look, if you're not talking during sex, you're not doing something right. You're not doing something right, because you have to check in with each other. You have to have a conversation. This is a continuous, and that is what not only Emory said, that's the law. Like you need to continue to check in with each other. Yes.
Question real quick that just comes to mind on that same. So you can't teach abstinence. You can't say don't do it first and then say but if you do, then please have consent.
I don't teach abstinence for a couple reasons. Because we are a university. These are adults, and so as it relates to that, and then the other piece is, I'm not telling you to have sex. I'm not telling you not to have sex.
Right.
I need you to understand that if you're going to engage in it, that there's a healthy way to do it and there's an unhealthy way to do it.
Gotcha.
And another piece of that is sex isn't rape. Rape is about sex.
Right.
Right.
Rape is a tool.
Right. Right.
I mean, rape is a tool. Sex is a tool.
Right.
Right.
So for somebody to say abstinence, you can still be abusive and harmful and not engage in sex. Okay. So you want to keep
brings me to the other point too, that the other thing that we also have to teach is that there's a difference between sexual assault and rape, right? There's a difference between sexual assault and rape. When we talk about sexual violence, right, and if we're looking at sexual violence and sexual assault as an umbrella, there are different forms that exist under that umbrella. And rape is one of them, right? Sexual battery, sexual molestation, that's one of them, but that's not necessarily the same thing. Yes.
How could that be?
Oh, one second. Go ahead.
Okay, so I'm a little, baffled, with the conversation, and we may have to excuse ourselves, she and I. And the reason why is because she has been taught abstinence. Who was that? Was that you that mentioned that? She has been taught abstinence. The words that are coming out of her mouth at 17 is, I don't want a boyfriend now. I don't want to be in a relationship now.
Right.
And I'm not having sex now.
Okay.
So what you're saying, and I might be totally wrong, so, and I'm not trying to, say anything negative, but what I'm trying to, I guess, get is, she's not, I don't, wait.
No, take
I'm
time.
sorry, ladies. I'm
No,
so
take
sorry.
your time. Like I said, this is a
So,
conversation.
She has a
Take your
17.
time.
I have a 17-year-old
Right.
that the words that are coming out of her mouth is, I don't want to have sex until I'm married.
Okay.
So you're saying that you guys you don't teach abstinence, or you're not talking about abstinence. I got that. But for somebody sitting in the room right now, and you're talking about the sex, and you're talking about the consensual part of it, but she's not at that mindset yet.
So you don't know what
So, I'm sorry?
you don't know what she knows. These kids know.
I didn't say I didn't know what, I didn't say I know what she knows. I know
Right.
that this child knows things. I do understand that. I'm not that crazy. I got a 30-year-old. I'm not that
Naive,
to know that she
they know
don't
about
know,
sex,
because she
yes.
does have other friends, so
Right.
she's not a hermit. But what I am saying is, the words that are coming out of her mouth to
Right.
me is that she does not want to have sex until she's married, and I believe that because I have a 30-year-old, so I know and they're complete opposites.
Right.
Trust and believe. We got two grandbabies, so I know that she's not married. So got that. So that's all.
Yes.
So I'm just saying.
So I'm gonna address it, and I think Mosi also has a hand. I think there's a couple things. One, I don't want you to get misconstrued that this is a conversation about sex. This is a conversation about consent. There is no one at any college that will tell your child, oh, you need to just have some good, that's not what we're saying. When we're placing consent in the context of sex acts, because we know that on college campuses, there are a higher number of sexual assaults that happen, period. There are a higher number of sexual assaults that happen within the first 6 to 8 weeks of students entering college campuses for the first time. We know that. What we're talking about with consent, we frame it in this idea of consensual and non-consensual sex acts, but honestly, when we talk about consent, we're talking about all forms of violence, right? And so no one would ever tell your child, oh, you need to have this kind of sex. Oh, this sex is great. Oh, this sex is this, that, and the other. No, that ain't what we do. But what we try to do is we try to have a conversation with them about a blanket expectation of how Emory sees consent. If this is something that you're going to engage in, just like any other policy, right? This comes from our sexual misconduct policy. Just like your alcohol policy, just like your other policies. We're not saying this is your permission to go and do your thing. What we're saying is for those of you who are choosing to do so.
Knowledge is power.
Right. I need you to understand that people have rights, right? So your child has made a decision to not engage in sex acts until she is married. Wonderful. What I also need your child to understand is that they are going into an environment where there are perpetrators of violence there. And I need your child to understand her rights. That's it. I mean, because what we also have on our college campuses are students who come who don't have a lot of education around consent, who don't have a lot of education, and will, if something happens, they will blame themselves. Well, maybe I shouldn't have, or maybe no, you have rights. And if you didn't want it, there is no coercion is a very huge issue on our college campuses. So when a lot of people think of rape, well, a lot of people think of sexual assault. It was like, oh, so why is it that they didn't fight back? Or I didn't see bruises or this, that, and the other. Coercion, manipulation, threatening. And that still stands as a violation of our policy. And so these are things that your child needs to know, even if they're making that choice. And so that's why. And I hope that better explains it. Because I don't want you to think, I'm going to there and tell the kids to just sex all willy-nilly. No, actually, I would prefer they just go to school for a class. But if they want to, yeah.
So, explain the fine line between sexual assault and rape, because no is no.
No is no and yes is yes.
Right.
That's what I'm gonna push back with. I'm gonna counter with yes is yes. So a lot of college campuses are coming with this, and it's not new. It just makes sense. If I want to do something with you, I'm gonna let you know. That's just kind of how it works. If you don't get a consent from me, you need to stop and check in. That's just it. If this is something that we're doing, and again, if it's not, it doesn't have to be sex. It can be anything. Like we just left a couple high schools this week where we did a consent exercise. Ask the students, do you need consent to hold hands? I don't know. Sometimes the first time, do you need consent to kiss your partner? The first time. Do you need consent to go through your partner's phone? Oh yes. So you mean to tell me that you need consent to go through your partner's phone, but you don't know if you need consent to put your mouth on somebody? Let's explain this, right? So it's this education piece that we don't have. When we're talking about this fine line, and it is a researcher by the name of David Leasack, right? Outline steps of perpetration and how they differ from consensual sex acts. And I think it's like 8 steps, right? And so, and I wish I had a board and things.
There's a board on that end. Do you want a board to write?
I would love one. I feel like I'm taking up a lot of time too, I'm sorry.
Do your thing.
Okay, so there are 8 steps to perpetration. What's really interesting is that these 8 steps look very similar to what could happen in consensual relationships, right? So, I'm gonna wait till they come down before.
No markers.
Okay, we'll get markers.
Okay, so I can just talk
I've
now.
got some at my desk, I can run up.
Or it's down here?
No, it's in the second floor.
Well, Yami's door.
Okay.
So when we talk about but at the end of the day, the main difference is intent, right? Yeah, that's perfect. So I'll use this to talk about the 8 steps of perpetration. I'll write on this side.
Okay.
It's completely fine. When we get markers, but we're talking about intent. Just with any form of violence, it's intent. So if you're in a relationship, how many of us consider ourselves in a healthy relationship with a partner? You got both your hands up. Yes. Okay. How many of us are you in these healthy relationships? Everybody. Okay? That's healthy. That's healthy. When is it unhealthy? When is arguing unhealthy? Hold on.
When it becomes disrespectful.
Disrespectful, what did you say?
When it's one-sided.
When it's one-sided, control, intent and control. That is the difference. If I tell you I no longer want to have this argument, if I tell you I no longer want to engage in this, we doing this no matter what, we're having a conversation no matter what, that's a whole different, we're going to a whole different field right now. And that's the difference. Sex, consensual sex, and sexual assault or rape, right, have very similar outlooks because sex is used as a tool. And so for a lot of people, it's very hard to kind of parse out the differences. The difference is control and power. Rape is never about sex. Rape is never about desire. Rape is about control. And if I tell you that I don't want this, and you have a problem with accepting that, there's another issue. There's some other systems that are going to work. And those systems are systems that are structured depending on who that person is. It can be privilege, it can be power, it can be entitlement. If I'm told my whole life that anything I want, I can get if I take it, and somebody tell me that I can't get what I want, what's the first thing I'm gonna do? I'm gonna say.
So I'm still not seeing the difference between sexual assault and rape.
So sexual assault is, go ahead.
That's the umbrella.
That's the umbrella that we're talking about.
Okay.
Everything else, touching, voyeurism, sexual battery, sodomy, all that is underneath that umbrella.
Right, okay.
All right, so David Leasack is one who, I mean, I don't even know what else he did in his life because everything else wasn't really important. But he's known for the work that he's done at looking at serial perpetrators, right, on college campuses specifically. So David Leasack did a study where he interviewed 2,500, 3,000 males on college campuses, right? And he asked them, the first question that he asked them was, are you a rapist? And of course, if you ask somebody, are you a rapist, what do you think the answer was? Oh, of course not. Oh my gosh, no. Okay, cool. No rapists in here. We ain't got no rapists in here. All right, great. So, question number 2. What's your hookup culture like? You see somebody that you like, what's your hookup culture? What do you do? How do you, when you see somebody that you're interested in, like what's your game? You got a game? What do you do? How do you do? What they found was when you reframe that and you talk more specifically about the tactics, that a lot of the tactics used to quote unquote for what I have, what I call a game, or the tactics that I use to show my interest in someone are very similar to tactics that perpetrators use when targeting and selecting victims. I hate to use that word, victims for assault, right? So one of the first things that they said was it's called target selection, right? So I'm a guy on college campuses, and this is, we know that sexual assault impacts men. We know that sexual assault impacts those in the gender nonconforming group. We know this, but we also know that statistically, overwhelmingly, over 80% of women are impacted, and so that is how the research flowed. He talked specifically to men about women. How do you get women? Well, you know, the first thing that I do when they come to campus, I always check to see like who's coming into campus. Are they younger? Do they not know they were around? Is it that they don't, they're not affiliated with anyone? Are they looking to be affiliated? Do they want popularity? Or even if they don't, like, are they just looking for a friend group? That's the person. That's the person that I go up to with my flyers and I say, I want you to come to my party. I want you. I am personally inviting you. I want to see you there. Make them feel special. I want them to feel special. I want them to feel wanted, right? So, okay. All right. So what's the second step? Well, once you get them there, after I select who I want, once I get them there, I go into this act. Ooh, I English major. I got degrees. Mr. Nice Guy. I'm very nice. I'm very kind. I'm very attentive. They're coming to my party. I don't want to talk to nobody else but you. It's just me and you all night. You want something else to drink? Okay, I'm gonna get you something. No, you ain't gotta ask somebody else. I'm doing it. I'm your person. I got you, because I'm really interested in you. As they're playing Mr. Nice Guy, there's tests, right? And so there can be something as simple as, I'm so glad you're having a good time. Can I sit down beside you? But I'm already sitting. So I didn't really give you the opportunity to say yay or nay. Or I just made a joke and I laughed so hard I put my hand on your knee. I'm gonna see how long you're gonna let me stay there. And if you get uncomfortable and if you move it, I know I probably need to give you a little bit more to drink.
Wow.
Okay. The next step after that is actually, what I'm actually gonna do is I have a very short limit of time right now, so I'm gonna have to speed it up. So after that, I'm probably not gonna get to all the 8, is isolation, right? I've been talking to you all night, now it's info gathering and isolation. I know about you, I know your major, I know what you wanna do, I know what sorority you wanna join, I know what fraternity you wanna join, depending on, because we all know, right? I know what organization you wanna join, I know a lot about you. So, you can trust me now. You know what, this music is so loud, we should go somewhere. We should go somewhere, like, I know that you said that you like this group, I actually got that new album, you wanna come back, we can always just go back to my place and we can. And if you don't, and if it's some pushback, it's like, so you don't trust me? I've been sitting here all night with you, nobody but you. Like, it's a party full of other people, I could have been dancing with other folks, I could have went home with anybody else, but baby, I'm spending my time with you, and you don't trust me? Me. To your head.
Right.
And so what happens here? Isolation. Once a person is isolated, a sex act may or may not occur. The difference is what happens in that sex act, whether it's consensual sex or sexual assault of some form, right? Or rape. Lisa said, okay, so what happens at this point? Well, at this point, I'm trying to figure out if we're actually gonna have sex. And if I'm in there and if I'm having a conversation and if it seems like it's going my way and if she's down for it, it's down, it's over, BTF, we're good to go, right? Well, what happens if this person refuses?
You gotta try harder.
Ain't no refusing, is what these guys said. There's no refusing. It's gonna happen. And so that's when at that moment, that can either be consensual sex or that can be rape. And so what happens after that moment, after the sex act is over, they become Mr. Nice Guy again, which is very confusing for a victim because now it's, man, that was so great. I enjoyed you, man. I should get your number. We need to go to the movies. What you doing next weekend? Because we got to normalize this now. But what happens if the survivor says, I didn't want this? Mr. Nice Guy goes away, and Mr. Nice Guy says, if you tell anybody, you'll never get into that organization that you want to get into. Because I let everybody know that you're easy. Because if you did this for me, you'll do this for everybody. This is not sex. This is rape. But you're gonna promote it and picture it and point it out as sex. And so what happens in this space is that a lot of women blame themselves, blame the alcohol, blame what they wore, blame who they were with, but they don't ever blame the perpetrator. Because we live in a rape culture and we live in a system where perpetrators are protected by this and by a lot of other things, a lot of other systems.
Have you ever heard any thoughts as to why they tend not to blame the perpetrator?
Yes. Oh, there is no time. There is no time. But we are.
Just give a few.
Yeah. So we're living in a system that is upheld by a lot of tenets that favor people who are male, straight, at the most, at the tip top of our system, male, straight, white, able-bodied, financially stable, anything else. After
Perfect
that,
academics or
right.
grades.
Popularity, like athletes.
Access to power.
Yes,
And
social
once you
status.
go down this
Social
chain,
status,
the
yeah.
lower you go, the less privilege that you have. And our society is built very specifically for a very specific group of people to gain total privilege, power, and access. Anybody else who has any other privileges, because we all have privileges, but there's a certain specific group that has more than anybody and will have more than anyone else. And any other form of privilege, it kind of trickles down and is lesser value, right? And so if you are a member of that group and you have lived your whole life having access to the top privilege and opportunities, you may not, but you may start to feel that other groups are inferior. You may feel and reduce people to body parts and to pleasure, and that is what happens. That is a rape culture. A rape culture is when we put a certain type of person, a certain type of idea of masculinity, of sexuality on high, and everyone else is inferior. And that's how violence happens, basically. So we went way off script, y'all.
Awesome, thank you.
Thank you.
Yes.
Thank you.
Were your questions answered, everyone?
Yeah.
Okay, awesome.
So are 6 through 8 someplace written
I
down?
like you already.
Excuse me,
Okay.
excuse me, are 6 through 8 written down somewhere?
Yes,
One
I
of
can
the
actually
pamphlets?
send.
You have a pamphlet with that?
I don't, but I can send it. I can send it to
Well,
you.
make sure everyone, make sure you sign in, left your email addresses so that the speakers can share information with
Yeah,
you.
sure.
And of course, the emails is not for me to bother you, but also to invite you for future events, okay? And anything that you need from the speakers, how to contact them, I'll make sure to share that with you guys.
Okay.
So please make sure you sign in. All right, so just to keep the program moving, now I want to introduce you guys to Detective Anthony Rayford.
Yes.
Rayford, and the podium is his. Thank you.
Hey, no problem. Good afternoon. Let me get myself set up first. So like Diane said, I am Detective Rayford with Emory Police Department. I've been at Emory for about 4 years now, just over 4 years. I've worked with Dept for 8 before that. So I got about 13 years in law enforcement altogether. I am responsible for the intimate partner violence cases, the sexual violence cases, missing persons cases at the university. And I am also the treasurer of the DeKalb County Domestic Violence Task Force, which meets about 5-6 times a year. So I just kind of want to get a quick show of hands. How many people here are affiliated with Emory? Work for Emory, go to Emory, whatnot. Is anybody familiar with Emory Police's crime log, daily crime log? So part of the Cleary Act that Wanda mentioned earlier requires that the university's police department keep a log of crimes that occur on campus. So I just kind of wanted to give you guys a few stats to start me off in my presentation. So calendar year 2016, we saw about 71 reports of sexual assault. As mentioned earlier, sexual assault is kind of the umbrella, the overarching umbrella. Under that, you can have rape, sexual battery, sodomy, child molestation. So when you hear people talk about sexual assault, that is the overarching title for different sex crimes. So we saw 71 reports. Out of those 71 reports, 65 were anonymous, and 7 were official reports where the victim, a family member, or a friend came to us and reported the incident on behalf of the victim. So when you start talking about anonymous reports, you know, to comply with federal law and the Clery Act, we take reports from programs such as the Respect Program, from student counseling, from human resources if it goes that far, from the counseling center. And you know, when people speak to, let's say, the Title IX investigator, that's, you know, we get reports from that way as well. But when you talk about anonymous reports could be as simple as saying, on May the 15th, I was sexually assaulted at so-and-so. Well, what is an investigator supposed to do about that? We don't have the name of a victim. We don't have the name of a suspect. We don't have the exact location, perhaps. So for us, those are considered anonymous reports. There's nothing for us to follow up on, but to comply with federal law, we kind of have to carry those stats. And the 7 official reports, out of those 7, I believe we had 4 actual allegations of rape, 2 sexual batteries, and I want to say 1 was, I can't remember the last one. Unfortunately, none of those went for prosecution. Some of them, you investigate. You don't have enough information to substantiate the claims. A few of them were mental health patients, older geriatric mental health patients who are not exactly sure what's going on and will report a rape. So that's some of the stuff that was unsubstantiated. And for comparison, you see UGA there with the green, blue, and red pie. They actually break theirs down for on-campus and off-campus assaults, as well as stuff that actually got reported to them. So they had 117 total in the calendar year of 2016. 36 were reported directly to their police department, 47 were unknown locations, and 34 were off-campus. Now, we don't specifically specify on our end if events happen on or off-campus, but a majority of them do happen off-campus. They're reporting it because they are members of, Emory University. They report it through the counseling service or Title IX, and then that kind of comes to us. When you start talking about family violence, we only saw 13 actual family violence reports. Now, we're responsible for not only the main university on Clifton Road, but also the junior college, Oxford, out in Newton County, and the Midtown Hospital. So a majority of our family violence cases are visitors from off campus. We get for some reason, we get a lot of cases from the mother and baby unit at Midtown Hospital where, a previous relationship comes up to visit with the new guy, and it's a big mess. But there are more cases of students at Emory being in incidents with their boyfriends or girlfriends, but unfortunately, for Georgia law, that does not qualify as family violence because they're not married, they're not, they never lived together, so that stuff doesn't get reported under the family violence laws. But I can guarantee you we have a lot more. We work with a lot of students who are victims of stalking, harassment, social media harassment, all kind of different things. And I think once you, and I'll go back to the sexual assault, once House Bill 51 is passed, I really think you're going to see a lot of that shrink. We're not going to have good information on what we have going on campus, which is very bad. Hopefully it does not pass. I can guarantee you that's going to shrink. We're not going to get as many reports as we used to, which is very, very detrimental to the college. And another little stat. So UGA has about 36,000 students, and Emory has about 15,000. But the difference with us is we have a lot more channels for students to report being victimized. The Respect Program, CAPS, student conduct, student life, Title IX. Yes, ma'am.
So with 51, can you explain what that would stop them? What you would not be able to report more if they pass the 51?
So and Wanda may be able to give a better explanation of exactly what they can't do, but if I'm not mistaken, they can't, the anonymity is kind of taken away when they report a crime.
Right, so
Really?
Under House Bill 51, House Bill 51 is a bill that's going through right now. I think we're at the Senate. And if it passes, it does a couple things. So, like I said before, when we were talking about confidential resources on campus, I would no longer be a confidential resource. We would no longer be considered a confidential resource. After the
just want to share with you guys what they're talking about is House Bill 51. When it's passed, confidential and anonymity, I can't say the word, but being confidential as a helper or as an advocate goes out the window. And so it risks the number of reports that will be documented, and it will risk whether or not students or any victim will be willing to come forth and report when something happens to them. So we need to advocate and call and talk about not having House Bill 51 supported. So I'm not sure why this particular bill is being brought forth, but we need to do our own research, get some better understanding, and advocate against it. So what House Bill 51 will do is strip away a lot of the Title IX privileges. And Title IX is put in place to protect victims. So I'm not exactly sure what the thinking is behind of taking away Title IX privileges.
And the bad part about that is you have a lot, it's such a tight community. So something that happens to a student, within a week, everybody knows. So you take away that ability to keep themselves anonymous, to seek care, and you hand it to us, and if we know that there's a threat on campus, the police have to do something. And when you start that wheel and that ball moving, things happen. We may wind up arresting the suspect. We may do some investigations and find out that this incident happened before. We may be able to gather evidence in different ways. So once you take that anonymity away and you force that person to kind of come to the police, there goes their ability to keep themselves safe on campus. There goes their ability to keep themselves anonymous. Yes, ma'am.
I have an online question. Someone is asking, why would they take away Title IX?
I think that's a tricky question. One of the guys, I think one of the sponsors of the bill made a really offhand comment saying, I have kids, I have sons, and I would hate for my son to be falsely accused. When you start looking at accusations, false accusations, they are a tiny, tiny number.
So it's in a way it's to protect the aggressors,
it's
or
to protect the aggressor. They're trying to they're putting it under the clause of due process. We want to give them due process, but when you start talking about protecting not only the victim but future victims, I feel like the school and the police department have a responsibility to act immediately and to take measures. And I understand that there may be false accusations every now and again, which, like I said earlier, is still a small number. But you need to be able to move to immediately protect that person and protect the campus. And what they're doing is putting it under the clause of due process and allowing those students the time to build their case or whatever they, who knows why they put it up, why they're doing this exactly.
I would suggest, I would encourage, because what you get on the news, it doesn't quite tell you what that bill is about.
Right.
I would encourage you to read it, call your legislator, because it's bad legislation.
It's terrible legislation.
Not public health, but it's not good legislation. It's doing a lot of damage if it passes.
And an earlier precursor of the bill was to take the responsibility investigating sexual assault cases away from the university's police department and give it to the local police department. I can tell you, I used to work for the cab. They're shorthanded. They have, thousands of more cases than Emory Police does. I think our last case count, last year was about 5,000. I can guarantee you the cab was easily over 125,000. So they just don't have the manpower or the resources to handle it, or they don't have the training to really be able to build a positive rapport with the students, with the people that they're serving. Because this takes a gentle hand, and this takes training to really, be able to develop that rapport with the students. And that kind of, segues into the next question. For us, we have to ask a lot of tough questions. And whenever I'm interviewing victims, I really, I give them a disclaimer up front. I'm going to ask you a lot of hard questions. I'm going to get very detailed. We need a lot of minutia when we're talking about the case. None of these, questions are designed to make you uncomfortable. If you start to feel uncomfortable, please let me know, and we'll stop. So let me ask you guys this: if I ask a victim, well, what were you wearing the night of? How would you guys take that?
That it was my fault.
Right. So police have to find a better way of phrasing that, because to a police officer, I'm looking at evidence. What if there's DNA on your clothing? The GBI and different forensics, with forensics advancing as much as it is, you can get touch DNA from clothing where somebody just has to touch you, and the little molecules from their hands will wind up on your clothes. And there's always a transfer of evidence. So police, when I ask that question, I don't ask the question like that, first of all, but when I'm asking that question, it's for evidentiary purposes. Do I need to take those clothes? Have you washed them? Is there a possibility that there's any DNA from the attacker on that, specific piece of clothing? But police in the past, not as gentle as they should be, and they'll ask questions like that without really giving a good explanation as to why they're doing that. So that's why for us, it's always important to kind of build that rapport first, to let them know that you're going to ask some questions that may make them uncomfortable, but none of them are designed to bash them. None of them are designed to make them look like they're at fault. Yes, ma'am.
You have a victim as your partner in front of you. Is it just you or the female victim as well?
It depends. So I have done interviews. It depends on the comfort level of the victim. Some of them prefer a man in the room. Some of them don't. Some of them prefer to have a counselor. I've done interviews where Adrienne Slaughter, who is a social worker, I can't remember the exact title, but she was in the room with me while I conducted the interview. So it's all in the comfort level. I think some are comfortable being around. I mean, I don't know the psyche behind it, but some are comfortable of being around somebody who is in a uniform, and some of them are not. They don't want to be around men, and every now and again we have interviews like that. So no, we do it whatever's the best for the victim. Any questions? So kind of going back to family violence, our hands are we have this mandate, the Georgia Family Violence Law, to affect an arrest when we can, but this, you ask, well, why do we have 13 cases and only 3 arrests? A lot of times we have, most of the domestic violence cases are visitors from off campus that come to the hospital, that come to the various clinics, that come to wherever on campus, and then they may get into it. And a lot of times those people are uncooperative. We won't have witnesses. People will go away. There may not be any physical evidence that we can go on. So that's kind of indicative of what happened. I think one of these cases, somebody, I want to say somebody spit on the other one. That was one of the arrests. So once we get these cases, not only do the police start their own investigation, but a Title IX investigator also has an investigation. Those are parallel. We can't really intersect until we determine that, one, there's not enough evidence to proceed. There's going to be no criminal case, which in most cases we'll take our evidence to the district attorney's office, or if it's a misdemeanor case, we'll take it to the solicitor's office. We'll present it. Hey, is this enough evidence for us to go forward with a trial or a case? They say yay or nay. If there's no evidence, then we can let our interviews and some of our statements be released to the Title IX investigator to kind of further their investigation alone. But it's never the other way. The Title IX investigator gives us no information. A lot of times, without the permission of the student, counseling services won't really give us any information, and that's all the confidentiality clause. And that's fine with us. We understand our role, and we try to play it as best we can. And as it says there, a majority of our cases just don't have enough evidence. With a majority of them being anonymous, of course there's no evidence, but the other cases, rarely do we get enough evidence either. And at that point, mitigating, the contact between the victim, between the suspect, mitigating, the potential for the suspect to do any further harm on the campus kind of becomes one of our primary focuses. The majority of our DV cases are handled by us strictly until sometimes it's involving students or employees. If it's involving visitors, then they have no affiliation with the campus, we handle it. If it's employees, HR can actually request, depending, let's say a nurse at the hospital wants to transfer because her husband at home, who she's divorcing, knows that she works at Midtown, she can request a transfer to main campus. EUA, she can request a transfer to St. Joseph's. So we have different ways of getting different entities within the university involved and kind of assisting with the process of getting them to safety. So how many people are familiar with the fact that we have a group that comes together, twice a month to talk about these cases, discuss ways to help students, to help employees,